small group medical benefits. So that group is, again, 2 to 50 lives. Your two most common options. Let's start with fully insured. When healthcare reform came about, you could no longer exclude someone, right, for pre-existing conditions, and everyone had to have access to a group plan. So fully insured was the way we went. So in this non-underwritten plan that everybody has access to, rates are determined by age and zip code. At the end of the year, you've paid for your insurance. The insurance carrier takes their money. Everybody's happy. Your insurance performs the same way it's going to perform in any other type of funding according to the employee. But the cost to the company sometimes is pretty darn high. So everybody in your organization is going to be charged a different rate for insurance, which can be frustrating for an employer, right? That's option one.
Okay.
Option two, we're going to talk about level funding. So in a level funded product, your employees do go through underwriting, right? So it's a health questionnaire, we're going to say. Sometimes it's census driven, meaning they're going to use name, date of birth, and some AI underwriting, which typically means they'll use that information to kind of figure out what prescriptions are being filled under that name with that birth date to kind of guess, right, what conditions those might be for, and then give you a rate that is unique to your employer group. It also levelizes premium for everybody. It really is specific to your organization. So you're going to have an employee-only rate, an employee plus spouse rate, an employee plus child or children, because one or three, it all goes into that same, or family. So family will include member, spouse, and children. And those rates are going to be set for the full year, regardless of who you hire. So new people coming in don't need to be underwritten. The difference in premium between that level funded option that has been underwritten and that fully insured option can be about 30% sometimes.
Wow.
I mean, it is a significant savings if you have a healthy group that's willing to go through the underwriting. Other than that, the plans themselves are going to function the same. The other big difference is that in level funding, there are some fixed costs and there are some variable costs. So your fixed costs are going to be like your admin, your stop loss, some other things. And then there's going to be a claims fund. So every month, a portion of the premium you're paying is going into a claims fund. That claims fund is building throughout the year and then being taken from as claims are filed. So at the end of the year, if there is a surplus in that claims fund, the company is actually eligible for a portion of them back. So for a healthy group, it can be really advantageous. Those claims funds can be a refund check at the end of the year, or at least a portion of it that you could use to put toward next year's premiums.
Okay.
So it's really the only two ways, if you're really building a group plan, to decide how you're going to fund it. Now, fully insured works. I'm not going to tell you it doesn't. I have a lot of groups who are fully insured, and some of that is because maybe they're a small group with some health issues.
Okay.
Having a plan is better than having no plan.
Right.
We can go level funded for those healthy groups and really try to not only save money, but possibly look at that claims fund surplus at the end of the year coming back. I'm not going to lie, most insurance rates continue to go up, but specifically those fully insured rates continue to increase pretty rapidly. The reason is the healthy groups have all figured out they can get off of it, right? And so all that's left in that pool are your quote-unquote unhealthy groups. That's it. Those are your two funding mechanisms when it comes to small group medical benefits. There is still a need for both, and I don't see that changing.